Hi everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. Today we're going to talk about a couple of self-massage techniques you can perform using a lacrosse ball. Hi everyone, so today we're going to use a lacrosse ball to perform some self-massage techniques, and we're going to do this sitting up in the chair because the other strategy of finding a flat surface might be a little bit challenging, especially early on after surgery. So if you are able to get down on the ground, if you are able to be on a flat, firm surface, there's a lot of different things that you can do. Either sitting with your legs out straight or laying down on the ground. But we're going to show you some strategies for in the chair today. And I like a lacrosse ball because it's nice and firm, but not super hard and firm or tiny like a golf ball. But you can use a golf ball, you can use a tennis ball, whatever type of ball that you have, you can use it to make it work. And when we're doing these activities, doing this self-massage technique, I don't want you to think about it as breaking up soft tissue. You're not breaking up adhesions. You're not breaking up scar tissue. The amount of force you'd need to do that is really quite tremendous. What you're actually doing is helping to provide a unique sensation to the muscles and the soft tissue throughout your leg, around your knee. And in doing so, hopefully it will help kind of decrease some of that perception of stiffness, some of that achiness and discomfort after your surgery. So first thing I'll do is the hamstrings. So I'll turn sideways, and I like to put the ball right underneath my leg and let my leg relax down on it. And there are a couple different things you can do. So the easiest thing is to just let the body weight of your leg come down on the ball and just let that pressure stay there for a couple of seconds, a prolonged period of time. And that might just in itself help to relax things. And you can kind of slide the ball around, find different parts, and hold it there as well. You'll notice the more you push down, the more pressure, the more intense it is. So you can kind of play around with that. Another thing you can do is, if you're able, is to kind of just roll the leg around on the ball. So you get kind of multiple areas at once, kind of do little circles. And the other thing you can incorporate is movement of the muscles. So straightening and shortening. So you can do leg raises, and you'll really feel this. This is going to be the most intensive one. And again, you can move it around and find different areas. Now for the quadriceps, I like to just use my hand and apply that firm pressure and just kind of pick a spot and rub it and roll it for a prolonged time, and then find another tight spot. You can do the inside part, the outside part of the knee, and just do it. And when you're laying down, you can really kind of add that pressure and lay on your stomach and put that pressure right onto the ball, but obviously that might be a little bit difficult right now. So instead you can just kind of use your hand and provide that massage with your hand as well. Then of course you can come down to the calf. You can keep it on the ground, but just so you can see in the video. And in the calf as well, you can provide that massage. Focus on the outside, switch to the inside, and just go everywhere that you feel that stiffness and that tightness. And again, we're not necessarily breaking up that scar tissue, but we're just kind of decreasing that sensation of fullness, that sensation of tightness, help improve comfort, help improve tolerance with daily activities, exercises, whatever it may be. You can also do this with a rolling pin. It's a really great option as well. I can do a video on that. Or a therapy stick, a massage stick, anything like that as well. And then you can of course go ahead and put it down and get the bottom of your foot. You can't see it on the video, but you can roll it all over the bottom of your foot and your plantar fascia as well. And so that's kind of the main things. Really easy, really simple tool. Don't make it too complicated. You know, you will hear things about, you know, wanting to bring the fluid back toward the heart, toward the center of the body. And you can do that. You can focus more on rolling and moving from distal to proximal, from your foot upward, but not necessarily the end of the world if you don't focus on that at all. All right, so that's a simple way to massage the muscles of your leg and your feet with a lacrosse ball or any type of ball, and doing it in a seated position in a chair. Thank you very much for watching, everyone, and take care.